Hey everybody, just checking in. Dr. Testone here. Hi. Wanted to just kind of check in and talk real quick about some progesterone deficiency issues. I've been seeing a lot of this lately in the clinic, and it's been, sorry, I'm going to try to get rid of that. It's been a little bit prevalent in the sense that probably we talked last time about estrogen dominance. And the second thing that I see the most is progesterone deficiency. A progesterone deficiency is going to be those things where it can be a couple of things. We think sometimes women that have estrogen dominance might only have, might actually have progesterone deficiency, but the reality is estrogen deficiency, or progesterone deficiency, sorry, can happen on its own. Estrogen deficiency can happen on its own. Or you can have the combination of estrogen deficiency with a progesterone deficiency, which only exemplifies the issues at hand. So just to recap, estrogen excess or estrogen dominance, you have signs and symptoms of breast tenderness, irritability. You can have, I call it the choke someone out syndrome. You can have irregular periods, fibroids, migraines, things of that nature. Progesterone deficiency, on the other hand, the number one thing that I see with progesterone deficiency is going to be insomnia. Women come in all the time and have problems sleeping. And, you know, some of that is for you moms out there that have young kids, they probably come in and wake you up in the middle of the night. But women tend to see this progesterone deficiency it manifest itself by having insomnia. And that insomnia can take a couple of forms, but the main form is going to be just a difficulty falling asleep. Now, sometimes they can have difficulty staying asleep, and that can be melatonin, or I use a supplement called hops, which is actually what they make the beer out of, but it's actually in a capsule, so you can take hops. I've gotten a lot of women off of Ambien taking hops, so it's pretty powerful. And the progesterone deficiency itself, though, insomnia is a big one. Some women who have had recurrent miscarriage, now we don't often talk about recurrent miscarriage, but the definition, the medical definition of recurrent miscarriage is women that have had 3 or more. The problem is, who wants to have 3 miscarriages? So usually if somebody's had 2 miscarriages, I'll work them up for a progesterone deficiency. And occasionally you will pick up somebody that has a progesterone deficiency in the middle half of their cycle. It also manifests itself, if you remember the books by John Lee, What Your Doctor Didn't Tell You About Menopause, or What Your Doctor Didn't Tell You About Perimenopause, is that a lot of the PMS symptoms that we see, irritability, mood swings, bloating, crampy pain, the week prior to or the week before your period is a progesterone deficiency. Progesterone is going to peak at the time in your cycle around day 21. So about 10 to 11 days after you ovulate is when your progesterone should be at its highest level in your cycle. And then that progesterone slowly falls, and that's when you have your period. So if you're not having regular periods, meaning you're probably having a period every 3 to 4 months, that's probably a combination of things, but it's a progesterone deficiency in the sense that you don't have an ovulation, because progesterone in your body is going to be made by the corpus luteum, which is when you ovulate, you make an ovarian cyst. That cyst ruptures to release the egg, and it then makes progesterone. That progesterone feeds back onto the fetus when it does implant, and then the placental tissue, when it's early on in the pregnancy, beta-HCG feeds back onto the corpus luteum to make more progesterone. And then eventually, at about 10 weeks, the fetal tissue, the placenta, makes its own progesterone, and the corpus luteum stops. So you've got placental progesterone when you're pregnant, you've got progesterone from the corpus luteum. You can get a little bit of progesterone production in other places, but for the sake of this, let's just talk about progesterone being from the corpus luteum, since we're assuming that nobody's probably pregnant. Robin Benson, nice to see you. So progesterone deficiency, we talk about insomnia, we talk about recurrent miscarriage. Other things are going to be some of the issues that we see with progesterone. If you want to think of it as this, if estrogen is kind of the female hormone that really is stimulatory, it stimulates, it's what makes women hormonally women, whereas testosterone is what makes men men, and this is obviously a simplification. But let's just say, for instance, progesterone then comes in and is kind of an anti-estrogen in a way. So you have the estrogen bringing up that kind of rise, that energetic push. The progesterone comes in and kind of calms things down. So if you don't have the progesterone in your body, or when do you have too much progesterone in your body? Pregnancy. That's why you're tired all the time. Progesterone can stimulate the sleep center in your brain. That's why it helps with insomnia for women that are progesterone deficient. So progesterone also can stimulate the appetite center in your brain. So women that are on progesterone therapy, and this is usually the alternative or synthetic progesterones like the horrible medroxyprogesterone or Depo-Provera. Depo-Provera is one of the few contraceptives, and I know that this could be argued, that actually causes weight gain. Now, there are many women out there that have different forms of birth control that complain of weight gain, and I'm not discounting that, but we know over the course of thousands of women through the data that medroxyprogesterone or Depo-Provera can cause weight gain. Now, bioidentical progesterone can cause an increase in appetite, just like pregnancy. Pregnancy causes an increase in appetite because women need an extra amount of calories. It also stimulates the sleep center in the brain. That's why pregnant women are tired all the time. But if you're choosing good food, so if you're choosing, low carb, and this is just my opinion, low carb, high good fats in your diet, and you're not eating a lot of processed foods, and you're eating vegetables and lean meats, then you probably won't gain weight. But if you are prone to carbohydrates, and hormonal imbalances sometimes can make women crave carbohydrates, then it's possible that you could gain weight on progesterone therapy. But usually those doses have to be rather high. Now, let's talk about migraines. And I've done videos before where I think I actually did one where I was having a migraine. And I've been a migrainer since residency, 19, 20 years ago. And it's interesting because my migraines tend to fall around certain times of the year. So usually, unfortunately, coming into November, December, tends to be when I migraine. And interestingly enough for mine, November is a time when my grandfather passed away, my mother passed away. And so it's somewhat of an emotional month for me. So I'm sure there's a lot of that tied in there as well. But for some women, they have catarrhenial migraines, which catarrhenial migraine is a migraine that's centered around the cycle. And we know from ICUs and from trauma victims, they are using progesterone in high doses in brain injuries to stabilize brain swelling, to stabilize the cells of the brain. And so I have used progesterone in higher doses. So a normal dose of progesterone is probably around 100 milligrams. You can use progesterone occasionally in higher doses, and I've done this for some women that have catarrhenial migraines, where I will give them a dose of maybe 400 milligrams to almost 800 milligrams at times to help with their migraines. So anybody out there that has questions about progesterone deficiencies, insomnia, recurrent miscarriage, migraines that are maybe related to your cycles, or any other hormone questions right now, feel free to ask. Kelly, thank you very much. I very much appreciate it. You do need to make your appointment to get this checked, Kim. If you just call the office, we might be able to even do your visit online. So please do call. So if we look at hormone deficiencies in the auspices of what I call an archetype, or a descriptive term that helps you connect with what's going on, I have called progesterone deficiency the unbalanced hero. And the reason that I call it the unbalanced hero or heroine is because there is no other time in a woman's life when she is on the hero's journey than pregnancy. And as I said before, pregnancy is the progesterone driven part of your life because progesterone levels are peaking in pregnancy. So for women that don't have adequate amounts of progesterone, they're on that hero's journey and they're unbalanced. So the point is, how do we balance the progesterone out? Well, you can look at it from different aspects. Obviously, you can supplement with progesterone, which would be very helpful. For some women, just supplementing the progesterone in the second half of their cycle, maybe cycle days 14 through 25 is very helpful. It gets them through the PMS type of symptomatology that they might have. You can have, let me just talk about one product. I get sidetracked, but things pop into my head. You get women that have progesterone deficiencies, or they're not feeling right, and they'll go to the grocery store, they'll go to the health food store, and they'll buy wild yam cream. And I don't usually take strong stances on a whole lot. The two things that I take strong stances on in hormones are pellets and wild yam creams. And the reason that I do that is because I don't want you to waste money. Wild yam cream has a compound in it called diascorea, or however you want to pronounce it. It's really not relevant per se, but it has a compound in it that in a lab, compounding pharmacies can make progesterone from this compound, but your body can't do it. So if you put wild yam cream on your skin and you absorb that compound, you can't make progesterone from it. So it's not really giving you what you need. So for women to really get a kick from wild yam, and keep in mind, wild yam is not the same as a yam that you get in the grocery store. Those are different types of yams. Wild yams are tubers or roots found in a different part of the world. So you can't just eat your way through sweet potatoes, although I will tell you that sweet potatoes are delicious. And if you're going to eat a potato, eat a sweet potato instead of a regular potato. I know it doesn't sound right because personally I think sweet potatoes are better, but I'm that person at Thanksgiving that really likes the sweet potato with the pecans and the butter and the marshmallows. And for some reason, none of my children seem to like that, but it is what it is. So anybody else have any questions about hormones, specifically maybe progesterone? I will say that we have seen a lot of progesterone deficiencies. I'm seeing them more and more frequently. There may be certain areas of medicine where they don't necessarily think progesterone deficiency is a huge problem, but I do think it's getting, ever since John Lee published his book 25 years ago, progesterone has gotten much more intellectual credence in the medical field than it used to have, back in the early 80s. So I wanted to come on today to talk about progesterone deficiency, specifically looking at things like headaches and insomnia and recurrent miscarriage. Linda, what are your thoughts about pellets? So I had this discussion with a couple of patients this week, and I'm very blunt, and I am not saying ever that my opinion is the opinion, but I've just come to this over, the last 5-6 years. I've looked at pellets. I've looked at doing pellets in my clinic, and I have good friends that do pellets. So I'm not saying anything is set in stone, but what I think about pellet therapy is this. The number one reason that I am opposed to pellet therapy is it's expensive. It costs probably in the neighborhood of $600. It's not covered by insurance. It's a surgical procedure, so unless, in my opinion, it's being performed by a provider or a physician that's done a lot of them, you can have serious complications. You can have bleeding, you can have bruising, you can have infections, and you're paying a lot of money for this. Now, you can get a compounded hormone cream for $40, $45 a month, whereas pellets are going to cost you probably in the neighborhood of $200. The other thing is, not only are you paying for the pellets, but you're paying for that surgery to have the pellets put in, and you have to do that every 3 to 6 months. I just don't think it's feasible. Second is you have to, so in your butt, they create this pocket with this trocar, and they deposit the pellets in there. So what happens is you get all of the dose at one time. And they're going to tell you that it's, it's slowly released. But here's what happens. You're going to get this huge spike over the first 2 months of your hormones, and then it's slowly going to come down. So you're going to feel either particularly grand for the first 2 months because you're going to get hammered with hormones, and then it's slowly going to decay. But you never really achieve a steady state. And I can tell you, because I've checked hormone levels constantly all day long, and women that get testosterone pellets have testosterone levels that are simply too high. They're just too high. And when you get too high, you have irreversible side effects like deepening of your voice, not reversible. You can have hair growth, which is not reversible. And granted, you can have it removed with laser hair removal, but it's not going to go away on its own. You can have cholesterol changes. You can have bone structure changes, facial changes. You just don't want to have consistently super elevated testosterone levels. What's this question? Hang on just a second. Does 150 milligrams of bioidentical progesterone along with low dose 80-20 biased in menopause seem like too much progesterone? That's a good question. The problem with talking about dosages and ratios is that it's going to be different from woman to woman. And the only way to know if one is too high for you or it's not appropriate is to check blood levels and actually look at the ratios. I used to have terrible migraines, but I changed my diet to plant-based, which is good. And they got less and less aggressive. You think that helps me or was it just coincidence? Well, I would say if your migraines got better when you switched your diet, that it probably isn't a coincidence. It's probably better. I will tell you this. I don't eat a plant-based diet. I can't eat a plant-based diet. Well, I mean, I probably could for a day or two. But what I found with me is if I decrease my carbohydrate intake to less than 20 grams a day, which I've been doing now for the last 8 weeks, and kind of have that mild ketosis, that my headaches have gotten immensely better. So I think it's really different for everybody else. Everybody. You probably do better. Maybe you do better with a plant-based diet. Plant-based diets, though, can have lots of carbohydrates, as you know, rices and potatoes and things like that. Whereas that may not be great for me because it might change my glucose levels over time, and that can, maybe kick my migraines in. So, but for me, a low glucose diet, a low carbohydrate diet, in ketosis is just better for migraines. So, yeah, keep in mind, I'm not saying bad things about anybody that put in pellets because I don't know their reasons. I'm just giving you my opinion as to why I don't like them. I've tried. I've called the companies. I've tried to look at it. They charge doctors money every month to be a part of their company. So like if you want to implant Sotopelli or BioTE, you have to pay a fee every month, not only, which then to me makes it look like or feel like you have to put them in, right? Because you're going to pay $900 a month to this company just for the pleasure of having their advertising. You're going to want to put them in. So, and I also think, and again, I'm not being critical, but I also think there's people out there putting them in that don't have any comprehension of hormone health. They don't have any comprehension of balance. They're not following levels appropriately. And there's women out there getting injured. There's women out there that are miserable because their hormones are off and they're paying lots of money. And I just don't want to do that. So, Kim Smith, because you're Italian. Well, that's right. That's why I can't eat plants, because I got to have my meatballs, got to have my chicken parm. It is what it is. Ethel, I'm trying to grab your question here. I had progesterone pills with each of my pregnancies. I noticed since my histo leaving ovaries, I have had bad insomnia and hot flashes. Doctor said because I have ovaries, I shouldn't have issues. Well, that is ridiculous. That is totally ridiculous. So just because you have ovaries doesn't mean that your hormones are balanced. I mean, at all. You may have great amount of estrogen, but you may have absolutely no progesterone. Your ovaries may not be making enough progesterone. You could have polycystic ovarian syndrome. You could have estrogen dominance. You could have progesterone deficiency. You could have testosterone deficiency. To look at somebody on the outside and just say, oh, this is what it is, great, that's great. But, how can you make that discernment if you don't have any labs to back it up? And I would find another doctor, personally. What do I suggest for PCOS? Well, that's a tough question. PCOS tends to be an estrogen dominant state because you're making estrogen and you're not making any progesterone because you're not ovulating every month. So sometimes what's interesting is the treatment right now, mainstream, is to give you birth control pills. And the reason for that is to just make you have a period, and the birth control pills will turn off your ovaries and technically, theoretically bring down your estrogen, but birth control pills are estrogen dominant states, so you might be trading one evil for another. So to really reverse PCOS, most of the time, probably 80% of the time, give or take, you're going to want to lose weight. And I know it's hard because women that have PCOS are also insulin resistant, and women that are insulin resistant have a harder time losing weight. So to bring down that estrogen level, sometimes we use DIM, or diindole methane, which is found from cruciferous vegetables. We can help you lose weight in other ways. Sometimes even 10 to 15 pounds can help bring back that ovarian function and lower that insulin resistance. Some physicians will prescribe metformin, which is a diabetic medication that does have risks, obviously, but for some women it works well. And hey, I wonder if I have my 4-year-old back that's hitting all the heart signs. So keep hitting the hearts, because what happens when you hit the hearts is this video gets out to more people, and I can maybe talk some more people out of getting pellets. No, don't get the pellets. So I would definitely ask your doctors to run tests. Now, if you're going to run tests for polycystic ovarian syndrome, hearts, here they come. Go, 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 go. You're going to want to check your estrogen, progesterone, testosterone levels, because testosterone can be elevated in PCOS. Thank you. I love them. I get them. You're going to want to check a hormone called follicle stimulating hormone, and you're going to want to check another hormone called luteinizing hormone. Now, in a normal cycle, follicle stimulating hormone, or FSH, is going to be 2-to-1 ratio of LH. So 2-to-1 FSH to LH. In a woman that has PCOS, that ratio is flip-flopped, and LH is like 3-to-1 FSH. So that's a hint. Man, thanks for all the love. I'm loving the love. The problem with PCOS is it's not a specific, there isn't one thing we can do to diagnose it. You can check ultrasound, you can check symptoms, you can check some labs. So overall, it's a picture, it's a syndrome, it's something that we can pick up on and discern from talking to you and maybe getting some labs. So what other questions do we got? Man, we had 100 people last time on the live show. We've got 20. I know it's late, so we're trying this later. Facebook told me that most of my peeps are online at 6 o'clock. But Jenny Stevens, who answers my phones and is my assistant extraordinaire, as well as Kim, got to throw Kim's name in there, wanted me to try this 8:30 deal. So we're trying the 8:30 deal and seeing how many people we can reach. I got pregnant after having Esher for 2 years. I knew there was going to be an Esher question. I got pregnant after having Esher for 2 years, and my doctor suggested that I get my tubes tied, but I still have my Esher coils with my tubes tied. Well, you can't. That was contraindicated. They shouldn't have tied your. That's very confusing. Even in the physician manual for Esher, they shouldn't. You shouldn't tie tubes unless they weren't working. But if they weren't working, then maybe they should have taken them out. Yes, you can still have them taken out, but I would only have them taken out by somebody like myself, Eric Sills, Ed Derone, Charles Monteith, maybe Dr. Aurora in Ohio. There aren't many of us that just remove the coils and remove them right. And if you've had a tubal, it's really important that you have somebody that knows how to do them so they can work around the scar tissue that might be there. Jenny says 8:30 rocks. Yes, indeed it does. except for when you're old. Like I am turning 50. Oh my gosh, in like 10 days, 11 days, I'm going to be 50. How horrible is that? Can you take progesterone while you are breastfeeding? Well, anytime you take hormones in pregnancy or breastfeeding, you can potentially screw things up, especially with breastfeeding. Progesterone shouldn't decrease breast milk production. It hasn't been shown to do that in studies, but everybody's a little bit different. So you'd have to go into it thinking that there's always a possibility. I take 0.3 milligrams of Premarin. Oh my God, how old is your doctor? I have been on this for 5 or so years. As of late, I have been having a lot of trouble sleeping. What do you suggest? The reason you're not sleeping, Kim, is because... Is this Kim from Tucson? Because that's like way back. But Kim, if you are using Premarin, first of all, get off of it. Get on something bioidentical. 2, if you're just on Premarin and you're not on a progesterone, the reason that you're probably having insomnia is because you're estrogen dominant and you don't have any progesterone. Now, a lot of women that have had hysterectomies, their doctors will tell them they don't need to be on progesterone. And I don't necessarily buy into that. I think it's all about balance and you need the progesterone sometimes. What do I use for replacement? Well, I use bioidentical progesterone either in a cream or Prometrium, which is a prescription that most insurance companies will now cover. That is bioidentical hormone. The only downside is you can't use it if you have a peanut allergy. Happy early birthday, 50. Yes, 50. Ugh. I had a hard time with 40, so I don't know how I'm going to do with 50, but maybe I need to be on like hormone replacement myself. I don't know. What can be causing extra high DHEAS levels, low T, low progesterone, high estrogen? Okay, well, let's take these one at a time, Rachel. High DHEA, first and foremost, stress. Secondarily would be like if it's super high, we'd want to check like an adrenal tumor or something like that. But 99% of the time, either you're taking too much DHEA or you're just super stressed out. Low testosterone, what causes it? A lot of things. Environmental stuff, stress. I think our diets nowadays, not in your case, Rachel, but some women with obesity, high estrogen levels will drive testosterone levels down, so estrogen dominance. Low progesterone can be caused by the things that I've talked about earlier. Your ovaries just not making enough of it. In pregnancy, sometimes your placenta won't make enough of it. And high estrogen, which is by far and away the most common one I see, high estrogen levels are caused by obesity, taking too much estrogen, birth control pills, our diets, environmental toxins like BPAs, there's hormones in the meat we eat, plastics, I believe things like the Esher coils, endocrine disruptors in our diet and in our environment, and things of that nature. So there's a lot of things out there that can cause it. Yes, Kim, that is you. Hey, it's nice to hear from you again. You can't sleep. Hard to say, Kim Marie. I don't know if you're not sleeping because of progesterone. It could be melatonin, could be stress, could be a lot of things. But if your progesterone levels are in the tank, that would be the first thing I would probably look at. And then you could also buy a supplement over the counter that's made by a company that I like called Nature's Way. You can get it on Amazon. It's called hops. Like I said, it's the stuff that beer is made out of. It's a flour. I've gotten a lot of women off of Ambien and other medications from using hops, and it's not addictive. Well, Kim, thank you very much. I'll let you say that as much as you like. So if you want to tell me how good I look, I'd be more than happy to hear that. Let's see. After a histo and removal of tubes and Esher, I feel very tired. Not much energy. What do you suggest I can take or do? Well, I would recommend you probably get your hormones checked. Now, there are a lot of women out there, and there's a lot of boards out there on Facebook for things called post-tubal ligation syndrome. And if you've had your tubes removed, if you've had a tubal, there are a lot of women that believe that that can cause disruption of blood flow to the ovaries and potentially decrease some hormone production. Now, theoretically, if that happened, it shouldn't happen long term, and it should be temporary, because you would think that the ovaries has a great blood supply from other areas, would pick up and make those hormones on their own. But I would just get your hormones checked and see what's going on. You're never wrong for having your hormones checked. You don't have to be old like me, 50 almost, to get your hormones checked. Just get your hormones checked. Find somebody that will check them. Another caveat to checking your hormones: you don't have to pay for it. You can go to somebody like myself who bills insurance and does blood. If you don't have the money to pay for huge amounts of tests, you don't have to do that. You can get it checked, and your insurance should pay for that. I have Esher, have crazy bleeding, painful irregular periods. Went to the gynecologist. She put me on estrogen to regulate my periods. Was on it for 3 months. Periods were regular. Now they are back. Well, first of all, if your doctor put you on estrogen, why? Did she even know what she was treating? I mean, or did she just throw you on estrogen? My guess is you were having those irregular periods because you had a hormone imbalance. Could have been, maybe it was estrogen, but my guess is it was probably not, and maybe you should get your hormone levels checked. Explain how you can order hormone testing for ladies that are not in Texas to see in person. Do I have the insurance? So you can call Jenny, and if you're online, you can post the phone number, 512-956-0296. Jenny can make you an online appointment with me if you want, and we meet on the phone. I get your history, get your symptoms and stuff. I can order labs wherever you live, and if you have insurance, I will bill your insurance. You can also try to find a gynecologist in your area that will do it. Gay Lynn, are you familiar with Dutch? Yes, I love Dutch. I order lots of Dutch tests. The problem with Dutch is that it costs $300, give or take. And so a lot of women would rather use their insurance when they come see me. So we'll order blood. But Dutch is great because not only will it give you all of the hormones, it will give you metabolites, it will give you melatonin, cortisol, and it will tell me how you're processing your estrogens to see if you're methylating or not. So the Dutch, in my opinion, is a great test. The only other downside to Dutch is that it doesn't test thyroid. So if we're wanting to check thyroid, we've got to do blood anyways. So yes, Linda, you can send me your hormones if you like. Hey, Kim's online. Lahana's online. All right, all these Austonians are online. Hey, Kelly. All right, glad to hear you're doing good. I just did 4 more surgeries today, so hopefully those ladies will feel good too. So my phone is running out of juice. Everybody, there's Kim. Look at her face. All you Esher patients and hormone patients, bother her. She loves to be bothered. She loves to be called at all hours of the day. Emily, hello. Good to see you. Haven't been on labor and delivery for a while. Pedro Torres. Any ladies out there looking for a single man, Pete Torres is the best surgical tech in the world. He's a little bit moody. He does get moody. You got to give him a Snickers bar, but then he gets better. But Pete, love you. I was there until 6 today. So my phone's running out of juice. Anybody have any last questions about hormone replacement? Give me some love. Give me some love. Give me some love. I'm relentless. I'm shameless asking for the hearts and the happy faces. I think the happy faces actually mean more on the Facebook algorithm. So, but I don't know for sure. There it goes. There it goes. All right. People that give the most hearts are going to heaven. So that's all there is to it. Pellets. Vicky, I don't like pellets. If you go back to the beginning of the broadcast, I will tell you exactly why I don't like pellets. Progesterone post breast cancer. Lauren, that's a great question. It's not an easy question to answer. Some breast cancers are progesterone receptor positive. So you want to be careful. You want to have a good relationship with either your oncologist or your gynecologist. And if you talk to them about it and they know you and you know them and you're able to have some really powerful discussions about your symptoms and what you want out of life, because obviously you have a say in this, right? Then you should come to a decision between the three of you. So, no, Lahana, I do need the hearts. You need to tap a bunch of hearts. See, now the last time I was on here, I had a 4-year-old that was tapping the heart sign. So I got a whole bunch of love. And I think the video got to like 170,000 people. So I think Facebook must push it out farther the more likes you get. So that's why I'm being shameless. I'll freely admit it. It's like the only love I get. So I gotta, don't tell my wife that. But it's fun. I like answering questions. I like being available. If you ever have questions, obviously, like I said, Kim loves it when you call. She loves it to death. Jenny obviously is there all the time. I think my connection's getting choppy. Hey, Betsy, my sister-in-law just joined. Woohoo! From Temple, Texas. I had receptor-positive breast cancer, and they do not agree with progesterone, which I used to take prior to breast cancer. So, Lauren, that's a hard one because I have a couple patients that are breast cancer survivors, and they are estrogen receptor positive and progesterone receptor positive, and they can't live their life the way that they want to live it without hormones. They're miserable. And so I have talked to their oncologist. I've talked to the patient. We know each other. We've known each other for years. And through those discussions, we have decided to go ahead and treat her because she can't live the life that she wants to live. So every case is a little bit different and personal, and you have to decide what's good for you. But I think that's a great discussion to have. Hello, Betsy. Don't like pellets. They're too expensive. They hurt. The hormone levels are not stable. They go too high and then they go too low. Did I mention they're too expensive? It's a surgical procedure. There's complications. And I don't see the point. If you're depressed without your bioidenticals, Lauren, then you need to decide if it's something that you can't live, you don't want to live your life that way, then you need to find somebody that can help you. And Lauren, I would be more than happy to talk to you. I may not prescribe hormones for you right off the bat. I would like to develop a relationship with you so I know you know me, I know you, and I know that you have the depth of understanding about the process that you're going through, and I learn about you and things like that. Crimes? Vicky, what crimes are we talking about? Pellets aren't. There's no crimes involved here. Or was that an autocorrect? Cream? Creams. I was like, I didn't commit no crimes. Creams. Creams I like better because pellets are about $600. Creams are maybe $35 to $45, depending on where you get them. Creams are different for everybody, obviously. They're easier to put on than a pellet. Skin absorbs hormones very well. It's just that everybody's a little bit different, so we have to alter doses based on the individual. But I do like creams. I use creams the most. Secondarily, I will use a sublingual troche or a sublingual tablet that dissolves for some women that don't absorb the creams very well or get tired of using the creams. You can use a vaginal suppository, which to me sounds rather messy. I wouldn't want to do it. You can use tablets or capsules that you just swallow. The problem with capsules is that about 50% of the dose that you take orally is going to go through the liver and it's going to get destroyed. Same thing with mist, Carolyn. Mist and creams are fairly similar. So you're spraying that on your skin. Estrogel, which is a gel, Eva mist, which is a mist, creams, it really just, whichever form is easier for you to use and whichever form that you're most comfortable using, whether, it's paid by your insurance or you want to go through a compounding pharmacy. I'm just getting these hearts. It's like, when you're almost 50 and you get these hearts coming through, it really makes a whole lot of difference. Now, I turned 50 on September 19th, and it's really interesting when you reflect on that kind of stuff, because my mom was diagnosed with ovarian cancer when she was 51, and I remember, I think I was 32 at the time, thinking, 51, that's an older age. And I'm like, sis, you sit here now thinking, gosh, how did she deal with that? How do you deal with that? So 50 doesn't seem that damned old, right? All right. Doc, if I call, will they pull my last record? If we have your records from the old office, Kim, I can certainly look at those. If we haven't gotten your records from the old office, then we're going to need to request those and get them sent over. And that way I can look at all your other stuff. Have you seen a person have a reaction to the troche? Yes, indeed. Rachel, the number one time that I see those reactions usually is if they get them flavored with citrus. You can get them like lemon flavored, orange flavored, tangerine flavored. Usually those citrusy kind of flavors tend to irritate the mouth, and you'll get those little aphthous ulcers everywhere. But everybody's a little different. When I was really prescribing those a lot more than I am now, the most common flavor was butter brickle. I guess it tasted like butterscotch, and I didn't hear a whole lot about that, but obviously everybody's a little bit different in how they react to things. So, well, Lahana, I do have a lot of life, and hopefully working with people like you will keep me on the straight and narrow. Yes, Emily, I am young. I am young at heart, and I'm not delivering babies anymore, so that ought to give me some life for a while, huh? So, yes, I am a Virgo, Kim. Kim's a Virgo, because Kim turns 32. Kim is 32 on Saturday. So we are Virgos, and Virgos are lovers, and, we're perfectionists. Although I do throw my clothes on the floor, so I'm not really a perfectionist. But, it's Virgos. Any other Virgos out there, you get it. Terry just joined from way back in Tucson. Man, all these nurses are coming back into my life. I'm actually going to Tucson this weekend. So, thank you, Sandra. 32 does rock. Look at Kim. She looks like she's about 22. Makes me nauseous. But live it up, Kim. Live it up while you can, baby. Right? What other questions before my phone poops out on me here? Anything about hormones? Any floating hearts you want to throw at me or anything like that? No, Emily, there's no hope for you. So yeah. I mean, I got out of it because I have a sugar mama, and because my wife works and she's great. I was able to stop delivering babies and do the hormone stuff, which is what I love to do, and the Esher stuff. So, and it's only because I have a sugar mama that I was able to do that. And she is wonderful, and she is very supportive, and also a very good OBGYN. Probably not as good as me, but pretty darn close. So if you guys need to deliver babies, or you want a female, you can call Dr. Lander, 512-451-8211. I'll throw in a shameless plug for Dr. Lander, although probably ought to come see me first. Kim, I don't know. I've never heard of that before. Yeah, everybody tells me how much they love my wife, and then they stare at me like, But I think people are right. She's pretty awesome. So why can menopausal hormone changes cause UTIs? They don't cause UTIs. They can make UTIs easier to get because it can change the tissues down in the vagina if you are menopausal. So strengthening those tissues with hormones, estrogens, and whatnot can make them stronger, can make it harder for the bacteria to get into the bladder. My doc is giving me a low-dose birth control for premenopausal symptoms and fibroid tumors, but I don't think I feel better at all. That's because birth control pills aren't going to make the fibroids go away. They have side effects of their own. Fibroids tend to be from estrogen. They like estrogen. They love estrogen. So giving them more estrogen sometimes with birth control pills isn't going to make things better. Um, I I don't know, Kim. I guess if you've had labs done and that showed a vitamin deficiency, I think taking lysine, which is an amino acid, can help with that. I think I've heard of maybe B vitamins helping with sores in the mouth too, but it's not my area of expertise. Sorry to say. Can't know everything. So, all right, I'm gonna give it 2 more minutes. What else? Anything else? All right. Well, maybe we'll end it for tonight. Remember, hormones, easy to check. Oh, hang on. What causes darkness over the upper lip? I didn't used to have it, and it's gotten darker in the last few years. Chances are, I obviously can't tell you without seeing it, but chances are you probably have something called melasma or cloasma, which is where you get a darkening of the skin from either the sun or from increased estrogen levels like you would get with birth control pills or pregnancy. And that's that kind of mask of pregnancy. What happens is you have a darkening, you have a deeper deposit of melanocytes in that area, and heat and certain hormones can make those darker. So, ladies and gentlemen, Nicole Hardum just joined us from New York City. Nicole is probably one of the smartest women on the planet about your periods, and you need to follow her on Facebook. So if you want to, Nicole, put up your links so these ladies can follow you on Facebook. There's millions of them that follow me, so you will get all kinds of followers from this. But Nicole Hardum, one of my all-time best friends that I've met once or twice. She's really smart, and she knows exactly what she's talking about. Follow her. Follow her. Push the button. No, put your link up. Yeah, and that's probably true too. Usually, Elva, it will get darker on your left cheek, and that's because that's where the sun comes when you're driving. So you're constantly getting sun bashed on that left side. So there's things you can take, and yes, follow Nicole Hardum. Nicole's going to pay me $100 for every person that follows her, so please follow her. Yeah, and so it usually is on the left side because that's where the sun's always hitting us when we drive. So sunscreen, and you can use things like kojic acid. You can use hydroxyquinone and things that can help lighten the skin, but you probably need to see a dermatologist or go to an esthetician. No, you're laughing, Nicole, but that was our arrangement. It was $100 a person, so that's what we got to do. All right, so see, I'm getting smiley faces now, and I think the smiley faces are actually worth 10 hearts and probably 20 thumbs up, so keep on trucking. Yeah, so, but you can get rid of those, Elva. I mean, it's not something you have to live with, and lasers can also get rid of that too, but you're talking about more money. So, I'm going to go. Worst lessers. Yes. Well, gay, it's hard to say, 28-year-old, but 28-year-old can certainly have hormone imbalances. And I see women in their 20s all the time. And you should definitely take her in to see somebody, whether it's a mental health professional too, obviously with anxiety. But I definitely think she should see somebody. Why would I get set on anxiety following out with these share and removal still have? Sometimes, Kathy, anxiety is anxiety. And in order to get to the bottom of that, you got to talk to a therapist, psychologist, psychiatrist, especially if you've, really dug deep and tried to figure it out and you just can't get there. That might be something that you need to check out. Check thyroid, check caffeine level, your caffeine intake, stuff like that. Rosalie followed Nicole, so that's at least $100 that I'm getting from Nicole. So, all right. So I'm checking out. My phone's gonna go dead. I've got 2 boys that probably haven't showered this week and are eating Swiss cake rolls for dinner. So I've got to go check on them because my wife is on call. and I will check in with you all later. Thanks, Kim. Thanks for the faces. Love you guys, and we'll talk soon.